the Vice Chancellor, Makerere University, Professor John Dumba Sentamu, the Principal College of Health Sciences, Makerere University, distinguished guests and delegates to the second annual conference of the Eastern Africa Health Professional Educators Association. That's a mouthful. Ladies and gentlemen, I've been introduced. My names are Sarah Kiguli, and I work at the College of Health Sciences, Makerere University. So it's a great pleasure and honor to me to welcome you all to this place as the first president of the association and the chair of the organizing committee for this conference. We have waited for this day for about 1 year now, and the past few months have been very exciting because we've been communicating with each of you, and we know many of you by name and what you are going to present. So to see you here gives us great honor and pleasure. Thank you for responding to our call and our invitation to be part of this conference. I'll just say a few words about the East African Health Professional Educators Association and also as the chair of the organizing committee to this conference. We've been told who we are. We are the educators of health professionals. We are the people who train, who educate the health workers, current and future, in the Eastern African region. And we come together, or we came together 3 years ago and said, can we work together? Can we collaborate? Can we support together as educators in the region so that we have a common goal, so that we can train and produce graduates who will be able to meet the needs of our region? And as we do, of course, we work with other collaborators in and out of the region. So our vision is that high-quality education is delivered by educationally knowledgeable health professional educators, and thereby improving the effectiveness of teaching and improving the quality of patient care. So our aim is to improve population health, and we cannot do this if we don't know anything, if we don't have the knowledge and skills about how to train health professionals. And that's why we need to come together, so that we can do things differently, so that we can be a change and make a change to the health of the population. And our mission is to improve the care of patients in Eastern Africa by enhancing our effectiveness. The objectives are many, and during this meeting, we'll go through them. We started, as I said, 3 years ago when we came together in Nairobi and said that we should come together and form an association. We are privileged to be joined by colleagues outside Africa who actually planned with us and worked together with us. And I take this opportunity to introduce these colleagues. Professor Arthur Hibo from Cambridge, he's been part of it, and he's been a very big pillar and support. Charlotte, who is with him, and also Bruce Dowman from the US. He also works in Kenya. And together, and other colleagues in East Africa, the treasurer for the association is Dr. Claudio Owino from Moi University, Kenya. He's here. Claudio, okay, he's there. We have the vice president, Dr. Dorothy Kamia. She is not yet here. And 3 years ago, we were given a challenge or a job to put the association into effect. And we've done that. We have a constitution in place, and we hope that before the end of this conference, we'll be able to elect new office bearers to move the association forward. We've also had a number of meetings where I've been trained in research in medical education or health professions education, a meeting in Kenya and Tanzania. And we hope that through this, we can generate evidence that will push this field forward. We had the conference last year. The first conference was in Nairobi, Kenya. And even if we are more than 100, I hope we'll be more this time. I've been attending medical education conferences for the last 10 years or so, but there's nothing as powerful as attending a conference where most of the participants are from the region, from the country, because we know our problems and we know the capacity we have. Therefore, we can work together to share, to support, to inspire, and also to move the field of health professions education forward. So I hope that at the end of this conference, we'll be able to address one issue. We'll be able, each of us, to be changed so that we can do business better, that our institution can also make plans to improve the way we train health professionals. But also as a region, we need to work together because we have common goals. And all this we do to transform health professions education so that the graduates will improve, have better quality, that we produce increased numbers of graduates because we have challenges, as you will hear. The theme for today, strengthening systems for health professions education, is in line with the efforts and recommendations at global level aimed at transforming health professions education. We decided on this theme about 1 year back, and we were happy that towards the end of last year, the World Health Organization came up with guidelines of transforming the training and education of health professionals. And we thought that it would be good to actually have these guidelines shared or a presentation from the World Health Organization, so that because this is in line with our theme and the topics, and we hope that before the end of the conference we'll see what to address as a reason. We are very grateful to the WHO office, Kampala, the country representative, for actually supporting this conference and for facilitating or making it possible to have someone from Geneva to come and speak to us today. We are grateful for that. We are grateful to the Vice Chancellor of Makerere University for gracing this occasion. Because we are here, we know that you support the transformation of health professions education, not only at Makerere University, but in Uganda and in the region. We have many efforts and many plans. Our vision is big. We need people to understand this and to support us. We are grateful for our principal, for the vision and leadership. We are also grateful to all of you for being here, for agreeing to be part of this and for sharing. We are grateful for other people who have funded and supported this conference to make it possible. It would not have been possible if you had not submitted your abstracts. Last year we had about 20 abstracts. Today we had more than 50 abstracts. Very beautiful presentations before I even listened to them. And I hope all of you will be able to stay and listen to them. I would like, before I end, to thank the members of the organization committee at Makerere who worked very hard to make this function happen. If you are here, you can stand up for recognition. A few of them are here. Dr. Mwesuga is there. Dr. Namatogo. So thank you for working. But the most important person who supported us is actually outside. And I know each of you know her. It's Evelyn, who has communicated and worked hard and supported all of us. So I wish you fruitful deliberations, and I hope that we'll all work together as we build for the future. Thank you very much.